Driving through Hyde County, you can go miles and miles to get to a grocery store, a fast food restaurant, or a gas station. But an even more critical need can be even farther. We're sitting here in Swan Quarter.
Yes.
What is the nearest hospital? How far would we have to travel?
We would have to travel to the nearest hospital in Washington, and that's going to be a 50-mile drive.
A drive that can be well over an hour. A time that was doubled when what was then Vidant Pungo Hospital in Belhaven closed 9 years ago, the hospital people here used to go to for emergencies.
I feel like there have been situations that have occurred where maybe the closing of that hospital was detrimental to an individual.
Now, residents here have the farthest distance of anyone in the state to get to a hospital, according to the North Carolina Rural Health Research Program at UNC Chapel Hill. And it means one thing.
That time is not on your side.
And in a community where fishing and farming are the big industries, accidents can happen, and time can be crucial.
Farm equipment is one of the most dangerous occupations, in the whole country. And grain bins and silos.
Dick Tunnell is the owner of Tunnell Farms. He has farmed this land for the past 50 years. In that time, he has needed emergency care.
I've rode to Washington a time or two, dehydration and whatever, and good service. But 60 minutes is critical.
That's why they stress safety and are fortunate, he says, not to have had any serious injuries over the years.
Yeah, you think about it. You think about it a little.
Hyde County is not the only county in eastern Carolina without a hospital. In fact, there are 11 such counties, which means no emergency care. Martin County is the latest to add to that list with the closure of Martin General Hospital. And people here fear the worst when it comes to critical care needs.
Without Martin General, I wouldn't be standing here today.
Martin County resident Debbie Fleckenstein suffered a brain aneurysm 5 years ago and was stabilized at Martin General Hospital before being flown to ECU Health Medical Center in Greenville. Now, the closest hospital for Martin County residents is 16 miles away at ECU Health Bertie Hospital.
If I'd had to go to Bertie, I wouldn't be standing here. I'd be dead already.
George Pink is the deputy director at NC Rural Health Research Program and has studied the issue of rural hospital closures across the country.
One of the disturbing things, I think, is that we found is amongst the rural hospitals that have closed, I believe that the median distance is around 15.5 miles. Well, 15 miles doesn't sound like a lot, but when you're in labor or when you're having a stroke or when you're having a heart attack, those miles can make the difference between life and death or a successful birth or otherwise.
Do you think not having immediate access to emergency care or a hospital, is it a life and death situation?
It could be. It certainly could be.
The solution here in Hyde County has been to have paramedics that respond to emergencies and helicopter pads where East Care can land to fly patients out. You might say they've stabilized emergency care here, but residents in Martin County see theirs in critical condition.
The fact that we don't have a hospital is just disheartening to me. It scares me, is what it does.
I'm sure that they are very nervous because they don't have that safety net right there in their back door like they've had. I'm sure they're concerned for how they're going to access care.
A concern also in Hyde County, but one that residents here have learned to live with.
We don't think about it every day.
If you live here, you know what you're dealing with.